question.
All right, so I just started the recording, so we're good. Okay, so if you could just give like a short explanation of just like what you do for a living, that would be great just to start.
Well, I assume um, you want to hear about what I did as a forensic psychologist versus what I'm doing now, which is not related to forensic psychology.
That's probably it.
Yeah.
Yes, that would be
Um,
great.
yeah. So we'll focus on what I did. So I'm a trained forensic psychologist, right? And for many years, I worked in the court system where I did evaluations for the court. So I worked at Cook County Juvenile Court where I did evaluations of the adolescents that were there, like fitness to stand trial, criminal responsibility, aid in sentencing, risk assessments, all different types of evaluations. And then I also worked in at Bridgewater State Hospital, actually in Massachusetts, where it's a maximum security mental health hospital, where I did very similar types of evaluations for adults. And then I also worked in doing like custody evaluations.
Okay.
So like parenting assessments, where there was abuse or neglect in the home. So that was the evaluation side. But then I also worked in the forensic department at the Chicago School of Professional Psychology for 13 years. So I also taught different courses in forensic psychology, and we have a forensic center there where I also did some treatment with people involved in the court system, where I would work with students who were getting their degree in forensic psychology as well. And so we did like parenting coaching, parents who had lost custody of their kids. And we're working to gain some parenting skills so that they were better equipped to deal with difficult behavior as opposed to abusing or neglecting their children, which is what they had done historically.
I see. Okay, that's awesome.
So all
Yeah.
of the things that I've done over
Oh
the
my
years.
gosh. Yeah, that's very interesting. I didn't realize that you weren't doing that anymore. I didn't realize that. It's my
I'm
bad.
still at the Chicago school.
You're just
But
teaching now?
say it again.
You're just teaching now?
So now I am the senior director of the National Center for Teaching and Learning. So now I'm actually over faculty development.
Okay, okay.
Yes. So I moved out of the forensic department and now I'm over faculty development. So it's a very different role.
Got it. Okay. And then, what sorts of reading or writing is used on a daily basis for your job?
Sort of reading or writing. So in terms of doing evaluations for the court, I'll talk about that because it's a lot of writing, right? So you're gathering information about why someone did what they did, right? And trying to understand their behavior in the context of their actions. And so you have to write a very thorough report explaining, about someone's background, their family history, about their education, about their mental health history. Have they been in treatment? Have they been diagnosed? So in really helping to understand their presentation, a mental status exam, talking about how they present themselves. And so the report has to be very detailed and helping the court understand how someone got to the point that they acted in the way that they did, because typically you're not called to testify. So usually a report stands on its own.
Okay.
And so very detailed. So the judge can read it and say, okay, now I understand what needs to happen, right, moving forward. Sometimes they will want you to come and testify. But more commonly, the report stands on its own. So in terms of the reading, you need to be really familiar with all of the mental health issues, with the criteria, of really having a sound foundation of the psychological issues to be able to reference them in the report.
Mm-hmm. And then is there like a certain way that you write to make it clear to people that like aren't in your field so that they can understand what you're saying?
Yeah, so we always talk about wanting to write at an eighth grade level.
Mm-hmm.
Because you want, any layman to be able to understand what it is that you're saying. So, like, you might, as an example, say, like, someone is experiencing visual hallucinations, right? But then you would define it, saying they're seeing things that aren't there. So that it's
Right.
clear to the reader what it is that you're talking about. So you're still using your jargon, of saying visual hallucinations, but then you're always defining in a way that's really basic language that anyone would understand.
Right. Okay. Yeah, no, that makes sense. That's kind of like what they have us do in class too, a little bit, like for the psych majors.
Right.
Okay. And then would you say that are any like overarching questions that you like address through your career?
What do you mean?
As in um like specific, it's just like if someone's fit to be a parent, or if like how do you like what questions are you asking when you're addressing your patients or the people that you're dealing with?
You mean like what's the most common types of questions we're asking during evaluations?
Yes.
Is that what?
Yes, yeah.
So it really depends on the type of evaluation, but I would say like we're pretty much always doing a mental status, so really looking at like, do they know who they are, where they are, like, are they oriented, type of questions, how able are they to verbalize issues? How able are they to attend to your questions? Do they seem in touch with reality? Those types of things you're always assessing with anybody. Pretty much you're always getting a social history because it's really important in understanding, is there a family background in mental health issues? Is there an abuse history? Right? What kind of educational history do they have? What kind of legal history do they have? Do they have repeated incidents of run-ins with the law? Is this the first time?
Right.
So that type of history is very standard. And then, diagnostic questions, in terms of giving a diagnosis of really understanding the types of symptoms they're presenting with to be able to say like, oh, this person is, suffering from PTSD or, from schizophrenia or depression or anxiety, or to really be able to articulate for the court specifically what is going on with them diagnostically. So I would say those are the most standard types of sections, and then depending on the question, you're going to be asking very different types of questions. If it's a fitness to stand trial, you're asking what is their understanding of the legal system, like what does a judge do, what does an attorney do, how, so very different kinds of questions depending on the specific nature of the evaluation.
And then are all like the way that you do the evaluations are verbally and observational? Are there any other like tests or things that you do?
Yeah, so there's a number of psychological tests that people use to have additional types of information. So there's some like personality tests, an IQ test. There's like different inventories that you have people fill out. So again, kind of depending on the nature of the evaluation, there are different types of psychological tests that you would use to help gather relevant information on top of interviewing them. So not only would you interview the person directly that you're evaluating, but you would interview collateral people as well, right? So like if they have been in therapy, you're going to try and talk to the therapist. You're going to get the therapy records. Or if they're married, right, you're going to talk to a spouse. So you're going to talk to the other people who are familiar with their presentation and how they've been doing to see is what they're telling you accurate, because we don't really take someone at their word.
Right.
You want to verify the information that they're telling you is accurate.
Right. No, that's fair. That makes sense. And then more like about you personally, like is this like the career path that you knew that you wanted to take, or like where did you start out with that?
It's funny because do you know that I went to New Trier also?
I did know that. I forgot about that.
Yeah,
Yes.
so when I was at New Trier, there was a class, like psychology and the law.
Hmm.
And do they have that now or no?
I think they still do, actually. I think they have it as an elective class.
Yeah, I think it was an elective class that I took in high school, and I loved the class. And at that point, I was just kind of hooked. So I was like, oh, this is what I want to do. And so when I went to college, I knew that I wanted to do something related to psychology and the law. So like I majored in psychology, and then I minored in juvenile justice. There was like a juvenile justice program there. And they had like an internship type program where I worked with kids who were involved in the court system, and I would meet with them weekly to just like check in. How are you doing? Take, like go get something to eat. It was
so
informal.
Funny. Yeah.
And then I would actually go to court. Like it was a very small town. I went to KU. And so Lawrence, Kansas was very small.
I didn't know that. That's where my dad went.
What's that?
That's where my dad went.
Yes, I know.
Did we establish this? We probably did.
We did, but why would you
Okay, continue on, sorry.
Yes, Lawrence, Kansas, they have this very small progressive court where we would then all sit around a table. Like it would be the judge, the attorney, the kid, the parent, me, they would have like a real therapist, and we would all sit around the table and talk about how they were doing, what types of additional services they need. So it was a fascinating program to be involved in and just get a feel of the court system and how you help kids who are involved in the legal system. And so, I was just hooked right from the beginning.
That's amazing. Wait, that program that you're talking about, they had that here as, like, something. And I wanted to do it, but it was, like, kind of far, and I don't have a car, so I, like, couldn't. But that's...
So it went an upperclassman where you might...
Yeah, I definitely want to, because I was, like, that's kind of, like, what you did and, like, what you're doing is pretty much, like, somewhat down, like, the path that I want to take. So I don't know, I'm very into like the profiling thing, like Criminal Minds, like that like is really cool to me. So yeah, that's so funny that you did that and that you loved it. That makes me want to do it now. I kind of regret not doing it.
Profiling is totally different. Like profilers are from like you go into the FBI.
Yeah, just like the overarching of what I want to do is just like understanding like why people like do the things that they do and like recognizing